Okay, let's just talk about it. If it feels like everyone you know is getting sick right now, and I mean really, truly knocked out sick, you are not imagining things. This winter illness season is just hitting differently. It feels more intense, it's definitely more widespread, and today we are going to break down exactly what is going on.
So let's get right to the big question, the one on everyone's mind. Why does this season feel so much worse than the last few years? It's a completely fair question, whether you're a parent with sick kids at home or you're just trying to get through your week without catching something. And, well, the answer is a little complicated.
And the reason is, we aren't just dealing with one bad bug. Nope. We are smack in the middle of what experts are calling a triple-demic. It's like a perfect storm where three major respiratory viruses, the flu, RSV, and COVID-19, are all circulating at really high levels, all at the exact same time. But one of them is behaving in a new and particularly nasty way.
All right, so let's dive into the main reason this season feels so awful. It's a brand new flu variant. And while you probably haven't heard its official name, you have almost certainly felt its impact, or you know someone who has. It's called H3N2 Subclade K. So what does that even mean? Well, to put it simply, it's a mutated version of the common influenza A virus. And that little mutation, that's the key. It has made this strain not only super contagious, but also able to cause much, much more severe symptoms than the flu we're all used to.
And just to give you an idea of what more severe really means, doctors are consistently reporting fevers in patients with this flu hitting 104, even 105 degrees Fahrenheit. I mean, wow. This isn't your typical flu fever. This is a sign that the body is working in absolute overdrive to fight a really aggressive infection.
And the other symptoms are just as rough. We're talking about a deep, phlegmy cough that just seems to linger for weeks. We're also seeing a lot more vomiting and diarrhea, even in adults, which is a bit unusual. And the body aches, people are describing them as just intense. But maybe the most concerning thing is that these super high fevers are really stubborn. They often don't respond well to the usual over-the-counter fever reducers.
And check this out. The data really shows how much this one new variant has taken over. Of all the H3N2 flu cases being analyzed right now, a staggering 89% are this one specific subclade. It's not just a flu virus out there. In a lot of places, it basically is the flu this season.
And hey, don't just take my word for it. The experts are really sounding the alarm on this. Dr. Suchitra Rao, an infectious disease specialist, put it really bluntly. She said she's never seen a flu season get this severe, this early. And you know, when experienced doctors start saying things are unprecedented, it's definitely time to pay close attention.
But here's the thing, this new flu isn't acting alone. To really get the full picture of this winter, we need to see how this subclade K stacks up against the other two major players in this triple-demic, RSV, which is hitting little kids and older adults especially hard, and of course, the ever-present challenge of COVID-19.
So how in the world are you supposed to tell them apart? Let's break it down. With this new flu, that sudden super high fever and the intense body aches, that's your biggest clue. For RSV, think of a really, really bad cold that turns into a nasty cough and wheezing. The main worry there is how it can inflame the tiny airways in the lungs, which is super dangerous for babies and the elderly. And then there's COVID-19. You know, with the latest variants, the symptoms are pretty familiar to us by now, but its high transmissibility is still the major threat, especially for high-risk folks.
You know, knowing the differences is helpful, but this next part, this is absolutely vital. No matter which virus is causing the illness, you have to know the emergency warning signs. You need to know when to stop trying to manage at home and when it's time to get medical help immediately.
This is probably the most important question for any parent or caregiver this winter, right? It can be so hard to know when a bad sickness crosses that line into a real medical emergency. So, let's make it crystal clear.
For kids, the absolute key is to watch their breathing. If you see their little ribs pulling in with each breath, or if you see any bluish color on their lips or face, go to the ER. Dehydration is another huge red flag. No urine for 8 hours is a very serious sign. And listen to this, any fever in a baby under 12 weeks old is an emergency. For adults, if you're having trouble breathing or you're short of breath, if you have persistent chest pain, or you just feel confused and out of it, those are all signs to get immediate care. And please pay special attention to this last one. Symptoms that seem to get better, but then suddenly come roaring back, even worse.
Okay, deep breath. That was a lot of really serious information, I know. But remember, knowledge is power. So now let's shift gears and talk about what we can actually do about it.
How can you and your family stay as safe as possible through the rest of this pretty challenging season?
First up, let's talk about the flu shot. Okay, because Subclade K is a newer mutation, this year's vaccine is not a perfect match. That is true. But, and this is a really huge but, it is still your single best defense. The vaccine can dramatically reduce your risk of getting severely ill, of being hospitalized, or worse. Think of it like this. It primes your immune system for a fight, even if the opponent shows up looking a little different than expected.
Look, the best approach is a layered defense. It all starts with getting vaccinated for both flu and COVID. Then, it's back to the basics we all know really work. Washing your hands like you mean it. If you do get sick, please wear a mask to protect the people around you. And finally, be so mindful of the most vulnerable among us. If you feel even a little bit unwell, just postpone that visit to see a newborn baby or an elderly relative. It's a really small sacrifice that can make a world of difference.
You know, when you boil it all down, what this severe winter is really teaching us is that our health is all connected. These viruses, they move through communities. But you know what else moves through communities? Protection. Every single time we wash our hands, or stay home when we're sick, or get a vaccine, we're not just protecting ourselves. We're adding a layer of defense for everyone around us. And in a season like this one, that shared responsibility, that's the most powerful tool we have.